Hello, everybody. Thank you so much for tuning in to our Facebook Live today. This is our third Facebook Live, and many of you have joined each week, so we certainly appreciate you joining us. For those who I haven't had the opportunity to meet, my name is Ethan Jordan, and I work for Odyssey Behavioral Health Care, supporting the team at Lifeskills and the business development efforts of the greater company. So thank you for being here. I'd like to take a quick second to introduce Dr. Arthur Chen, as well as Amanda Bassos from the Lifeskills team, who'll be sharing about the really important work done on the trauma clinical pathway at Lifeskills. So without further ado, Amanda, Dr. Chen, I'll give it to you.
Thank you. Thanks, Ethan, and welcome to everyone joining us. Again, my name is Amanda Bassos, and I am part of the business development team with Lifeskills South Florida. For those who might not be as familiar, Lifeskills is a dually licensed treatment facility where we provide care for adults who present both with complex psychiatric concerns and also substance use disorders. And we offer residential level of care and an outpatient level of care, both PHP and IOP. So at Lifeskills, given the clinical concerns that we usually see, we offer 6 different evidence-based clinical pathways for our clients who, based on their need, would be assigned 1 or 2 of those clinical pathways. So of course, we offer DBT, we offer cognitive behavioral therapy, we offer CRT, cognitive remediation therapy, substance use disorder, and also metabolic fitness. So outside of those 5, we're going to focus specifically on the trauma clinical pathway today, which I'm excited about to hear a little bit more and highlight Dr. Arthur Chen, who is one of our psychologists and also a certified clinical trauma professional who oversees our trauma clinical pathway at Lifeskills South Florida. So welcome, Dr. Arthur. We're grateful to have you.
Thank you. Thank you for having me.
Of course. So Dr. Arthur, can you give us a little bit of an explanation of what the trauma clinical pathway looks like at Lifeskills?
Sure. So the clinical trauma pathway actually starts from the very beginning. Every client that comes in, regardless of what the referral question is, right, whether it's substance or whether it's primary mental health, will have as a part of their comprehensive biopsychosocial intake by their clinician a trauma assessment. Now, the trauma assessment both assesses their earlier childhood experience, earlier adult experience, but also what symptoms they're experiencing at the time. Things like panic attack, nightmares, flashbacks, et cetera, et cetera. If the clinician at that time feels like, hey, this client or this patient might be having some traumatic reactions, because sometimes the client doesn't identify something as trauma, but we certainly know it can be traumatizing. If the clinician flags it, what happens is it'll get referred to either myself or my colleague, Dr. Laura Scroot, to be able to do an assessment and a further in-depth assessment to see if they would be appropriate to be a part of the trauma pathway, co-occurring with some of the other pathways they talk about, like metabolic fitness and cognitive remediation, cognitive processing, et cetera, et cetera. When they come into the pathway itself, what they'll do is they'll go to one of 2 groups and then the 3rd group. So the main trauma groups are on Tuesdays and Thursdays, and they're broken down by gender. What that does is it allows them to have a conducive, sort of safe environment, but also a small environment to be able to process through whatever their trauma story is or whatever it is to process through. And then from there, there's also a seeking safety group that also runs, which teaches a client sort of how to manage their traumatic reactions, how to be able to ground themselves, and do a lot of the skills-based stuff that we really know that is very helpful for PTSD and especially complex PTSD.
Absolutely. Those are great modalities that are in place. And I appreciate too that some of the groups are separated, even a little more specifically by gender. Yes. Can you speak a little bit to who would best benefit being part of the trauma clinical pathway? What are some of the presenting concerns that we typically see from individuals?
Sure. So when we think about trauma, the diagnosis and sort of the DSM criteria that comes to mind is PTSD, right? Post-traumatic stress disorder. But what we know is, if any clinician has sort of been in the trenches for a while, is it's never a clear-cut disorder. It's never somebody really, I probably should say never, but it's oftentimes not somebody who just has just the PTSD symptoms. And we often get a lot of complex PTSD. And as you're mentioning, being dual licensed with substance abuse and primary mental health, we get a lot of that intersection. And it's a synergetic effect. Both sort of feed off of each other. So oftentimes we have clients with sort of that emotional dysregulation, the negative self-perception, the behavioral dysregulation, the difficulty in maintaining the relationship, and really honestly, just difficulty with distress tolerance. And the other part that adds a little bit of sort of complexity that is a lot of the stress they're experiencing is, it might be externally triggered, but it's a lot coming from internally due to history, due to the past, whatever it happens to be. So it's really to be able to give that client with that complex PTSD, emotional dysregulation, behavioral dysregulation, misperceptions in reality with some other sort of mental health disorder, anxiety, depression, access to, or substance use, and really having those meld together. That's what we sort of specialize in, work with that complex case.
Absolutely. I think that was a beautiful way to describe and highlight how many times the internal trauma certainly externalizes itself. Yeah, absolutely. And how do you find that trauma work might be helpful in an individual's journey to or toward recovery? What have you seen and what have you experienced in your time practicing?
Sure, and the one thing that I would say is the trauma becomes the underlying foundation to a lot of that behavioral dysregulation, right? And for some people, behavioral dysregulation looks like punching a wall, and for some people, behavioral dysregulation looks like staying in their bedroom. But for others, it looks like self-harm, and yet for others, it looks like substance abuse. And so while those things, the self-harm, the substance abuse, the anger outbursts, are what is most evident that we see in our court system and in our clinicians' offices, in school referrals and all of those things, what we know is that's not the beginning and end to those behaviors. That oftentimes there is that emotional dysregulation, that emotional fervence, and that discomfort and that negative self-perception that really drives those things to truly and holistically sort of work with that client to treat not only the symptoms that they're having, but the underlying cause. It's not only treating the cough, but the bacteria infection, if you will, that becomes really important for us.
Yeah. Absolutely. Thank you so much for that overview and the time to highlight the work that's being done at Lifeskills. We're grateful for you. We're grateful for the team at Lifeskills, the work that you do, and the care that you provide to our clients on a daily basis. So thank you so much for joining us, Dr. Arthur. Continue to be well. And for anyone who has any questions about Lifeskills, about our trauma clinical pathway, please feel free to reach out to myself, to Dr. Arthur, to Ethan. We're happy to answer any and all questions you may have. Thank you so much. Thanks, Ethan.
Thank you.